For complete study material, WhatsApp now to 971502515717. Morphine side effect: A. Tachycardia, B. Hypertension, C. Tachypnea, D. Bradypnea. Patient with ongoing magnesium sulfate, the nurse should be alert to: A. Temperature, B. Respiratory rate, C. Heart rate. Soldier was brought to triage area after being exposed to chemical weapons. Signs and symptoms of nerve gas exposure were noticed. A nurse prepares for medical management. Which medication should the nurse prepare for the patient? A. Atropine, B. Adrenaline, C. Sodium nitrate, D. Sodium thiosulfate. Nitroglycerin administration route: A. Intramuscular, B. Sublingual, C. Subcutaneous, D. Oral. A nurse checks the medication chart of a part, which has the following order: nitroglycerin, tab, buccal at stat. Which of the following medication administration routes should they? Nurse use: A. In the ear, B. Intravenous, C. Under the skin, D. Between cheek and gum. A nurse is caring for a patient who had coronary artery bypass graft surgery, CABG, 4 hours ago. The nurse notices that the patient has increased confusion and is restless. The patient reports nausea, weakness and paresthesia in the extremities. C. Lab results. Normal values. Result test. 134 minus 146 millimoles, L. 145 sodium. 3.5 to 5.2 millimoles, L. 6.8 potassium. 2.15 to 2.62 millimoles, L. 2.50 calcium. Which of the following is the best medication? A. Naloxone, Narcan. B. Hydralazine, apresiline. C. Potassium chloride, KCI. D. Sodium polystyrene sulfonate, Kioxalate. Which of the following statement by the nurse about the Clomid as an ovulation-inducing drug? A. Given for the first 15 days in each cycle. B. Maximum dose is 50 mg daily for a month. C. It increases the risk of birth defects. D. It increases the risk of multiple pregnancies. Clomiphene citrate, Clomid, is prescribed for a 32-year-old infertility treatment. The nurse should understand that this medication is used for following actions. A. Induce ovulation. B. Decrease prolactin level. C. Reduce endometriosis. D. Stimulate the release of follicle-stimulating hormone. A nurse is caring for a client with bipolar disorder, who is receiving lithium carbonate. Before administration of the next dose, the client complains of nausea and vomiting, and the nurse finds that the client's lithium blood level 1.5 MEq, L. Which of the following actions is considered a priority? A. Call the client's physician immediately. B. Withhold the next dose. C. Administer IV fluids. D. Repeat the blood lithium level testing. A patient was on a regular dose of lithium carbonate. The nurse noticed he has hand tremor, polyuria, diarrhea and vomiting. What immediate action should be taken by the nurse? A. Diuretics. B. Withholding lithium. C. Calling the psychiatrist. D. Monitoring serum lithium level. Which of the following? For complete study material, WhatsApp now to 971502515717.